My name is Andy Wilkins. I'm founder of a think tank called Future of Health, but I'm also program director for Imperial College's leading systemic innovation in healthcare program.
Andy, you started off your presentation on innovation in health, but it surprised me that the first slide was about global economics. Why was that?
Well, if we're going to think about health in its biggest context, it's not just the health of humans as we currently think about it, it's also the health of the planet. So what I wanted to do today was really start off with the biggest possible picture to talk about what are we collectively doing with respect to the health of the planet and the health of our civilization, and then drop down into the healthcare specifically as a subset of that.
You showed some scary numbers on the cost of healthcare. Can you give those headline figures and the actual impact if we do nothing?
Well, currently, our healthcare system in the UK, for example, costs about £160 billion a year, which represents about 10% of the entire GDP of the British economy. It also represents about 40% of government spending. And as we get an older population with more chronic diseases and more things to prescribe, just to keep the healthcare system going on as it is at the moment, there's an inbuilt inflation of about 4 to 5% because of that older population with more diseases. So if we don't do anything, we just keep the health system as it is with a few more doctors and a bit more money, in the course of about 10 to 15 years, it will double the cost of our healthcare system, which will probably likely bankrupt the country. So we're on a bit of a burning platform. So to do nothing but keep the system going is a choice to incur that kind of cost. So we need to do something. And that was the beginning of my presentation, really, on the health system.
Is this where innovation comes in for early intervention?
Yes, if you look at the costs, most of that accrue from these chronic diseases, which generate so much in terms of poor health and costly services. But up to 70% of the NHS's costs could be saved because these chronic diseases aren't necessarily something that people are condemned to get. So how do we change behaviors? How do we create an environment where people can live healthier has to be part of the answer to this challenge of healthcare of the 21st century.
When it comes to R&D investment, what areas should it go into? Because actually, it's not a cost; it's investing in the future, isn't it?
Yes, you're right. There's, if you look more broadly, health and biology itself is the area of greatest investment in venture capital money, investment money. There's a huge explosion in the capabilities, the breakthroughs that are coming through. So it's not necessarily R&D investment of the health system itself. Already there are technology and biotech and life sciences and med tech companies doing that investment. The challenge for health systems is how does it take advantage of this new capability to be able to improve the quality of how health is done today. But I think the real interesting challenge and opportunity here is how do we detect disease before it becomes established? Because if we can get better at that, then we can save a huge amount of cost in the future of avoidable long-term conditions and avoidable complications.
I was really interested when you talked about the digital twin, because I know there's a National Innovation Centre for Data and the National Innovation Centre for Aging in Newcastle, and I've already interviewed them. So this is kind of ties both of those two things together. So do you work with those innovation centres, and can you talk more about this digital twin?
Certainly. I haven't worked with those centres, although I'd be very interested to talk to them. The work that I've been doing is really to imagine if the trends in new medicines, new breakthroughs, new sensors, new diagnostics, new biomarkers are really going to come on stream in the next 10 to 15 years. What we're going to be faced with is increasing real-time data about my body, my behaviors, the context I'm in, the environment I'm in, the resources I'm using. So it really was looking into this future saying if we're going to get exponential amounts of data, much of it real time about individuals and populations writ large, how do we make sense of that data in such a way that can be both useful for those actors involved in providing care, so they're going to have to deal with a lot of real-time information, and how do we turn that information around so it can be useful for individuals about their own health? And this is where Google and others were saying, if you're really dealing with a complex system with exponential amounts of data, it's a digital twin model that's likely to be the best way of doing that. So really, this future speaks to a world where electronic health records will probably migrate into the future into something like a digital twin. And if we put large language models and other technologies that are appearing on the scene on the front of that, what that digital twin will start to do is become possible to turn it into something akin to a digital health coach that can help people see and understand their holistic health and give them personalized advice, contextualized to their own need, their cultural needs, which I think represents quite an exciting new addition to what we could be doing in the future in healthcare.
If you could end on one thing that we need to hear as a society to help ourselves, what would that be?
I think because our healthcare system has been quite paternalistic and quite mechanistic, it's institutionalized a very sort of factory production way of doing health where the expert is the doctor and they tell you what to do. This is kind of institutionalized people to think that if anything's wrong, I go to the doctor, they'll give me a pill and give me a medicine and I'll be better. I think this future is really saying the knowledge, the sensors, the data, the information, the breakthroughs are really going to put lots of information back into the hands of people to understand themselves, their families, and their communities in much more detail. And I think any future is not just about a healthcare system doing to people. It's people becoming more engaged, more knowledgeable, and more active as participants in their own health. And I think that's a really exciting challenge, but also an opportunity for society in the future.
Actually, there's one thing I forgot to say. As a business owner, because of the costs and taxation that goes into healthcare, as a business, our role in all of this is to ensure we have a healthy workforce before they get into the chronic stages. That, in the long run, well, it's better for the country, and it may, if it reduces NHS costs, healthcare costs, it could reduce taxation. How do we incentivize businesses to do more for the staff for the greater good?
So you're right. I think if we don't do anything collectively as a society, then it will inexorably lead to higher taxes and higher taxes on business. So there is if you like, a drag on business from not addressing this health through this challenge of higher taxation. But I think there's also something far more practical for business as well. If we look at the current levels of sickness, whether it be mental health, musculoskeletal, or chronic diseases, we're seeing higher rates of absenteeism than ever, and also higher rates of presenteeism, which is people turning up to work but not really able to fully function. And some of the research indicates that's up to 70% of an employee's workforce is not fully functioning. And then you think more critically about that. How much loss of productivity are organizations facing from having the majority of their staff not fully well, not fully able to contribute all of themselves to their work? Their creativity is compromised, the productivity of the organization is compromised. So there should be some real incentives for businesses to want to have a healthier workforce and play their role in making that possible.
Thank you, Andy. Thank you for your time.
Thank you very much.